Gangrene and Civil War. The wait for treatment can be a day, maybe more. It's not out of the ordinary. The surgeons wear the same clothing every day, drenched in the blood of hundreds of different men. When an instrument is dropped, it is rinsed in cold, bloody water, tainted with flies and disease. Instrument sanitation by the surgeons of the Civil War is not practiced. Blood residue from previous operations lingers on the bone saw, poised to enter the bloodstream of the next patient. Many diseases will eventually take hold and kill more soldiers than the war itself, if something is not done. The medicine of this time is extremely limited, and in combat situations, surgeons are forced to work as fast as possible to save as many men as they can. Unfortunately, this need for speed they practice sacrifices quality. Wounded soldiers are brought through the field hospital as though they're on an assembly line, allowing the doctor very modest time with which to complete the procedure. To add to the distractions, men are screaming in delirium, while others are in shock. Soldiers with head or chest wounds are not even attended to, as they will most likely die. Attention is only given to those who have potential to be saved through surgery. The mini ball, a round lead shot, is the most devastating round ever used on the battlefield. When the shot strikes a bone, it does not break cleanly, rather it shatters and splinters into pieces, leaving a bloody, painful mess. This means that the most common battlefield surgery is the amputation. During an amputation, the surgeon saws away at the limb with the bone saw, the patient screaming in agony while restrained by 2 or more people. Once the limb is completely severed, it is tossed into a growing pile of miscellaneous body parts. The arteries are then sewn up with whatever type of thread is available, and the skin is sewn up around the stump, save for a small hole which is used for drainage. The ensuing problem is gangrene. Gangrene refers to the death of a part of the body when it loses its blood supply. The amputations that take place in the Civil War lead to many cases of gangrene due to severe blood loss. After a limb is amputated, the stump bleeds for days and even weeks afterward, resulting in significant loss of blood and eventual development of gangrene. Typically, the skin turns blue and purple, loses the complete sensation, and emits a foul-smelling odor. As it gets worse, the affected area turns black and begins to shrivel up. At this point, the only solution to slow gangrene is to develop a treatment, or those who are seriously afflicted will eventually die after suffering from constant, unrelenting pain. The priority of the World Health Organization at this point in the war should be assisting the medical practices by funding research and delivering medical supplies to the Union and Confederate camps to help reduce the frequency of gangrene within the field hospitals. If gangrene can be halted, it will greatly decrease the number of potentially fatal amputations. In addition, funding is necessary to procure methods of sterilization and antiseptic, which will reduce the spread of infection and disease.